Greetings everyone. I am Dr. Premkumar Balachandran, Senior Consultant and Clinical Lead of the Apollo Institutes of Hernia Surgery and Abdominal Wall Reconstruction here in Chennai. A very common topic which affects a lot of people is groin hernias and ventral hernias. Now what are these groin hernias? Before knowing that, one has to know what is the groin. The groin is basically the lower part of the abdomen which joins the thigh. This is also called as the inguinal region. So a lot of youngsters nowadays, they move into physical activities very quickly and prolonged standing periods, exercising, lifting very heavy weights, chronic coughing, smoking. Any issue which increases the intra-abdominal pressure normally causes pressure on the lower abdominal wall. So what this does is it tends to push the intestine into the scrotum or the inguinal region. So this is called as a groin hernia or an inguinal hernia. So who is commonly affected by inguinal hernia? Usually it is younger males, but as time goes by, even elderly people, they also develop hernias due to prostatic hypertrophy, when the prostate gland increases in size and they start straining while passing urine, or elderly people who strain too much while passing motion, or those who smoke a lot and having chronic cough. So all these people are more prone to develop groin hernias. So people also ask me, can women develop groin hernia? No human can escape from a groin hernia. The only thing is that the incidence of groin hernias is more common in males than in females. So what do you do once you get a groin hernia and how will you present? So normally what happens is some patients come to me and they say, Doctor, I'm fine during the day, but as the day progresses, I find a small lump in my groin and this starts having a small dragging kind of sensation with discomfort. These are the usual symptoms of an early hernia. Some people complain that, Doctor, I've got a huge swelling in the scrotum, but when I lie down for some time, automatically it reduces. This is a sign of a complete hernia where the intestine has completely descended into the scrotum, and this is called as a complete inguinal hernia. Other people will complain of chronic groin pain, and these are also symptoms of a groin hernia. So whenever you are having any discomfort or pain or dragging sensation in the lower abdomen, you should always suspect that you've got a groin hernia and you need to seek surgical attention immediately. Okay. Now we are going on to ventral hernias. What are ventral hernias? The abdominal wall, it extends from the upper abdomen to the lower abdomen. So usually these ventral hernias will occur following a surgery. These are also called as incisional hernias. Now why do these happen? When you have a surgery, you are actually advised to take a rest for a certain amount of time. If you start exerting very quickly immediately following the operation, then the surgical line tends to become weak and this will cause a recurrence or a hernia. So these are called as ventral hernias. Okay. Now how are these treated? Like I mentioned, when you have symptoms of a swelling in the abdominal wall or a swelling in the lower abdomen associated with pain and discomfort and dragging sensation, then you need to go and see your physician. They will evaluate you thoroughly, do investigations like a CT scan, ultrasound, etc. And once you are diagnosed with a groin or a ventral hernia, then you need to have surgical treatment. Groin hernias and ventral hernias do not get all right on their own, and no amount of rest, etc. is going to make these hernias all right by their own. All hernias require surgical attention, and it is better to seek surgical treatment before you end up in drastic complications. Because as long as a hernia does not get complicated, everything seems to be okay. But sometimes if the intestine gets obstructed, then life-threatening emergencies can happen. So always it is better to seek elective surgery and prevent any complications from happening. So most of these hernias are usually amenable to laparoscopic surgery, wherein you can go and get your surgeries done and go home within a day or two. It is very, very effective, and a mesh will be used for repairing the groin hernias and the ventral hernias. Usually groin hernias the patient can be going home the next day, and ventral hernias probably 2 or 3 days in the hospital, and they will need to take rest for about a week at home, after which they can go back to normal work. Thank you very much.